it comes to genuine learning, you'll find that today when you'll be writing the answers, when you'll be explaining some of the concepts, very important, when you'll be going for those keywords, they will actually create wonderful sparks in your brain. This is what is needed. Otherwise, exam to what, right? This is like you are fighting against yourself only. So it really doesn't matter that out of 30, you have answered whether it is 27 are correct or 29 are correct. It's fine. If this format, because right now the number is 52, we are 52. Because today, whosoever will be giving this test now, I mean, they are like genuinely interested in learning. Because see, out of more than 400, like this current number is so low. And it happens, even in past also. On the day of examination, always the presence used to drop. So it is like, if you like this format, then definitely in cardiology, this is what is in my mind. In cardiology, because cardiology is like BAP of respiratory system. It is that good. Right? So what we'll do is, after about say 3 weeks, right, after about say 10 or 12 sessions, right, roughly about say 10 sessions, about 10 sessions, we'll be conducting the cardiology test. That will be cardiology test part 1. And then we'll proceed for the rest of the topics, and then we'll go for the cardiology test, final test. Right? So that way, you'll be able to say remember the things, and then definitely we'll be conducting one test simply in the form of MCQ. But today, it will be like almost like USMLE, eliminate MCQs, right? Hardly there will be any MCQs. Once we complete all these questions, then we'll discuss every question in detail. That is what ideally should be the answer, right? Let's say if this question is asked in Viva, so then what should be the answer? And yes, I received some of the materials. So because right now it is test, so we won't be solving those problems, but then they are part of this exam. So when we'll be say, revealing the answers, at that point we'll discuss. All those points will be discussed very properly so that there is no confusion. All right, it's 10:35, right? And the number has almost stabilized. We are about 60 friends. So yes, all the way 1, 2, 3, 4, right? Numbers are already put into those questions. We'll start with question number 1. You have to write it, right? So don't put less space. You might have to write up 2 or 3 sentences in some of the cases. In some of the cases, it might be less. Okay. So, and I'll upload this file in 2 formats. One, this whole file as it is, right? This whole file as it is, which is having only the questions. And then the second file, in which we'll be solving it. So I'll save it in a different way. So one will be the test file, and second the solved test file. Okay. So wish you all the best, and don't worry about the time restriction. 30 questions, but you'll be given enough time. Right? Enough time. So I'm starting the timer now. Normally it would be like 1 minute per question, but in some of the cases I know it might take more time. So automatically I'll increase the time into those specific questions. Okay. So be your best, and wish you all the best. And we start. Okay. Here comes the question number 1. You have to write the answers in your own books. You don't have to write answer in the chat box. Okay. You have to answer. So write like 1, and then whatever the question which I have asked, we'll be writing the answer of it. And then that's how we'll complete 30 questions, and then we'll solve them. It would be the self-check, right? You'll be checking your answers by yourself. Any query, any doubt, you can ask. Just to make it clear, you don't have to type answers in chat box. All good? Okay. So, good number. Let's start. Here comes the first question. What is tension pneumothorax? And what type of injury leads to it? So first you will tell what is tension pneumothorax. And what type of injury leads to it? Instructions are like this is question number 1, and in your book, right, you will write the answer of it. Correct? You don't have to write any answer into the chat box. That way we'll finish 30 questions and then we'll come back to question number 1 with the correct answer so that you have to check by yourself. Proper whatever is needed, right? There is nothing like one word answer. In this entire exam, there won't be anything like one word answer. No, we are not recording this video. No, we are not recording. There is no need. There is no need. All right, on to the question number 2. You'll be given good time for this. What is the differential diagnosis of chest pain? Right. When the person is having chest pain, there can be several things. So I made it easy. Name any 3 conditions. When we'll be doing this thing, when I'll be taking your medicine test, this number will be 10. Correct? Once you go in post-graduation, this number will become 30. But right now, just name any 3 conditions using your logic. 3 conditions. Person is having chest pain. So that chest pain will be due to this, due to this, due to this condition. 3. Just 3. That is what is called as differential diagnosis. Right? You have to just name 3 conditions. You don't have to write anything in detail about any of those conditions. Question number 3. What is the path of pulmonary circulation? Omkar, you don't have to write in chat box. That's what I am telling. You don't have to write in chat box. Please write in your own book. Right? Question number 1, answer. Question number 2, answer. Question number 3, your answer. Then finally, after completion of this, we'll solve it. Okay? Nothing is to be written in checkbox. This is path of pulmonary circulation. That is, pulmonary circulation starts from where, ends where. So you have to write from start to end. Right? And obviously, whatever, this is the beginning, this is the end, and whatever comes in between. Something which we have drawn several times. I'm trying to go slow, but in case if you find that you need more time, immediately let me. Then you can tell in chat. On to the question number 4. Which muscles are used for quiet inspiration? muscles used for quiet inspiration? नहीं दोस्त, जितना पूछा उतना ही लिखिए. I have not asked for forced inspiration. ठीक है, so no need to write for that. Question number 5. Which type of rib movement increases the transverse diameter of the chest during respiration? Remember, transverse diameter. Okay. We learned some movements out of which one specific type of movement is increasing transverse diameter. Just you have to write down name of that movement. You must have seen that questions are pretty simple, right? Quite easy. Arey Dinesh, don't write it here. Right? Please write it in your book. यहाँ पे मत लिखिए. No need to write in chat. Okay. Question number 6. Sternal angle lies at the level of intervertebral disc between which and which thoracic vertebra posteriorly. You have to just fill these blanks. This one, this one. In other words, this is one vertebra, thoracic vertebra. This is another thoracic vertebra. This is the disc. And this is the angle, the level of sternal angle. Which number is this? Which number is this? Coming up is question number 7. List any 5 anatomical changes which are occurring at the level of angle of Louis. The angle of Louis, right? There are some things occurring at that level. You have to name, you have to list 5 out of them. There are more than, there are about 10. But you have to just name 5. Any 5. Yes, any 5. If it's done, we move on to question number 8. Which number of ribs are called vertebrochondral ribs? You have to write down rib numbers. That is like rib number 4, rib number 5, rib number 6, that way. Right? You have to write down rib numbers. Okay, on to question number, because this is just a number, right? So you can easily write in 5 seconds. On to question number 9. Read carefully. which area of intercostal space is not safe, right? Remember, it is not safe to introduce the needle for the lung biopsy. You want to do a lung biopsy. So you will be passing a needle through intercostal space. Which area is not safe? Definitely, we have discussed this. Not once, but so many times. Right now, I can't speak much. Take it like exam. But why are you writing it in chat? That's what I'm telling you. Don't write. No need. On to the question number 10. What is transpulmonary pressure? What is transpulmonary pressure? This is like, this pressure is like, there is one pressure minus there is another pressure, and that is what is called as this transpulmonary pressure. So what is this pressure? What is this pressure? Like something so important, because it is trans. Okay, on to the question number 11. Let's on to the question number 11. Increased compliance leads to increased elastance in pathological condition. True or false? Just this is the statement. No, just pathological. It's a just a condition. Point is, increased compliance leads to increased elastance. Is it right or it is not right? Must true or false? That's what you are saying. Because from our previous discussion, you must have known that both of them, they are one of the important concepts, correct? Based on these two only, all the pathologies are lying. So, just true or false. Don't write in chat box, my dear friend. No reason for true or false means can't say much right now. Definitely, it is either true or it is false. So, on to the question number 12. I'll just reduce it slightly. Now you should be able to see. Identify the marked structure. There are two structures marked. So just write it like 12A, what is it? And 12B, what is it? No, you don't have to write down the reason. Just true or false. That's it. Okay? And over here, it is 12A, 12B. Right? So what is 12A? Write down. What is 12B? Write down. False. Okay, don't get confused. I'm asking for this black shed. Okay? I'm not asking for the vertical. Okay. Yeah, person is healthy. Absolutely healthy. Next one, question number 13. I identify the mark structures over here. Now, let's say for the 13A, right, I have highlighted that structure so that there is no confusion. In 13B, though, it is, you know that, right? It is quite obvious. So that's what we'll do. Right. Should I zoom it? Sure. Definitely, Nirman, this is not the exam of literature. So, say, I'm just giving you the example. Instead of this plura, if you write like plura, as far as your concept is fine, not to worry, that's fine. Because this is just a beginning. At a later stage, as you become more and more senior, right? It is expected that you don't make spelling mistake. अभी के लिए बहुत tension. Understanding is more important. Yeah, I can remove this, no problem. Right, I can remove this. This structure which has been asked. Next question. What is the purpose of the Clement test? Clement test. Question number 15. We are midway. What is the function of type 2 pneumocytes? So half of the exam is complete and now we change gears. Now let's move on to some of the questions that you think of it. So on to the question number 16. Smaller alveoli are less prone to collapse as compared to a larger alveoli, considering the rest of the conditions same. True or false? No reason. Reason is not. I mean, when we'll solve this, at that point, we'll discuss the reason. Right now, no reason to it. Just true or false. Next, question number 70. What terminology is used to describe black areas in ultrasonography? Because radiology is absolutely black and white. Whether we talk about X-ray, whether we talk about CT scan, whether we talk about MRI, or whether we talk about USG. So in both the cases, there is black area, white area, black area, white area. Sure, 16th one. Yeah, here it is. So in radiology, right, there is black area and white area. So when it comes to X-ray, you are writing a report. You are telling that this area is white. So you don't say this area is white and this area is black. There are some words used. So we learned it. Sure. So out of all of them, we are talking about ultrasonography. In ultrasonography, if you look at the area which is dark, so then it is called as what? There is one word for it. Right? That is the word which you have to write. What terminology? Okay. On to question number 18. Functional residual capacity is the sum total of which two volumes? FRC. That's right. FRC is sum total of two volumes. Which two? Now keep it simple. Nothing like increase, decrease, kuch nahi. Just functional residual capacity is the sum total of which two volumes? Just reply whatever is asked. Bas, that's it. I mean, you say it is sum total of this and this. Bas. On to the question number 19. Identify the condition. Everyone should be able to answer this thing without any problem within 5 seconds. You know? Question number 20. What is the chemical name of the surfactant? The full name. Just the name. Structure is not needed. Only the name. That name. Bas. On to question number 21. Identify the condition. Pretty easy. Deliberately, I will not put any of the new X-rays. That is one. And very straight, simple questions have been asked. Those who have joined a bit late, let's say you joined from question number 9. So don't worry, continue from there. And at the end, we'll just go through all of them at a slightly higher pace. So just continue with the current. This is which question number? This is question number 21. 21. On to the question number 22. What is HPV? Or the full form is hypoxic pulmonary vasoconstriction. So what exactly it is? This is where you have to write in slight detail, so that when we'll be discussing it, we'll be, this is the process which we'll discuss at length, right, when we'll solve this. I got it. There was some confusion. We'll solve all that confusion. Right from very basic till the contraction, we'll take the complete path. Don't worry. But right now, this is only the concept which has been asked. I have not asked the mechanism. Right? What is it? In YY, if it is asked that what is HPV in pulmonary system, what would you say? First? On to the question number 23. What would be the mean arterial pressure of a person with blood pressure of 150 over 90 millimeter of mercury? You have to calculate mean arterial pressure. Pretty simple maths. You won't need calculator. Question number 24. What is core pulmonale? What is core pulmonale? Okay, so this core pulmonale, and question number 22 was this. What is HPV? Hypoxic pulmonary vasoconstriction. The next was where you are supposed to calculate. You are supposed to calculate mean arterial pressure for a person whose blood pressure is 150 by 90. 150 systolic, 90 diastolic. And this one is what is core pulmonale? Question number 25. Which are the two most important pressures responsible for the balance of fluid into the arterioles? Just you have to name the pressure, name of the pressures. Question number 26. Name two reasons or two conditions or two pathologies. It's all one of the same for etiology for development of pulmonary edema. Okay. Question number 27. Which are the two types of polypeptide chains found in the adult hemoglobin type 2? No need to write about others, just type 2. Adult, it's the adult, not the fetal. Question number 28. Ductus arteriosus is the communication between which two vessels in fetal life? Ductus arteriosus. 27. Sure. There is a hemoglobin called adult type 2. So it is made up of which two types of polypeptide chains? And 28 is ductus arteriosus is the communication between which two vessels in fetal life? Next one. The lobes of left lung. Answer of this is either it is very easy or it is very easy. Okay. Is this ductus arteriosus? It's a structure present in fetal life connecting what and what? I mean, there are two vessels, right? It is connecting them. So, what is this vessel number 1 and this is vessel number 2? And name the lobes of left lung. Question number 30. You can see that there are several lines. You have to just write down names, bus, name of them.
आणि पुण्यात एक आहे बघा पंडित गाड्याला हे लावलं लोगो लावलो टोपी ठेवलं असे ते तुम्ही पंडित लय भारी बघा हाय कोण आहे म्हणते पोलीस तुमचं हाय किती ट्रॉफिक
Okay, so all set. Great. Anyone who was not present during the initial part of the test, you want me to scroll through all the questions fast? Alright. You'll be going a bit fast. So here it is. This was the question number 1. What is tension pneumothorax and what type of injury leads to it? You have to just write what is tension pneumothorax and the injury which leads to it. Next one was DD of chest pain, differential diagnosis of chest pain. Name any 3 conditions. Path of pulmonary circulation, right? From where it starts, where it ends, and what comes in between. Which muscles are used for quiet inspiration? Right? Only the quiet inspiration muscles. Which type of rib movement increases the transverse diameter of the chest during respiration? Right? Transverse diameter. Sternal angle lies at the level of intervertebral disc between which two thoracic vertebrae? So this is the intervertebral disc. So which vertebra is this? Which vertebra is this? Which thoracic vertebra? Right. Number. Yes, you have to write the number. List any 5 anatomical changes occurring at the level of angle of Louis. So what is happening at that level? Anatomical changes. Yes. Which number of ribs are called vertebrochondral ribs? Which area of intercostal space is not safe to introduce the needle for the lung biopsy? What is transpulmonary pressure? Here you have to write that there is one pressure minus there is another pressure, and that is transpulmonary. Increased compliance leads to increased elastance in pathological condition. True or false? That's you have to mention. True or false? Yes. That's all. Then you are supposed to identify the structure. This is 12A and 12B. Then identify these structures, 13A, 13B. Then from this point onwards, we were all present. What is the purpose of Clement test? What is the function of type 2 pneumocytes? Smaller alveoli, they are less prone to collapse as compared to larger alveoli, considering the rest of the condition same. True or false? Terminology which is used to describe black areas in USG. FRC, functional residual capacity, sum total of these two volumes. Identify this condition. What is the chemical name of the surfactant? Identify this condition. What is HPV? Hypoxic pulmonary vasoconstriction. What would be the mean arterial pressure of a person with blood pressure of 150/90? Or pulmonale, what is it? Two most important pressure responsible for the balance of fluid into the arterioles. Two reasons for development of pulmonary edema. Two types of polypeptide genes found in adult hemoglobin type 2. Ductus arteriosus, that is communication between these two vessels in fetal life. What are the names? The lobes of left lung. And finally, identify the things which are marked. Okay. So now, start with sorting them. Because you'll be testing yourself, right? So it will be absolutely your decision. Right? If you feel like, I missed something, so you can give half mark to yourself, or if you've written totally fine, you can give full mark to yourself. If you feel like, there was a major problem in the concept, so you can even give 0 mark to yourself for that particular question. Right? It is you who is working against you, right? Means fighting with yourself. You want to improve. So here it is. What is tension pneumothorax? In tension pneumothorax is, if you have written air in the pleural cavity, right? Air in the pleural cavity. So that is what is called as the pneumothorax. But because it was tension pneumothorax, the keyword would be progressive. So if someone has not written the word progressive, so that means just cut the half marks. It is the progressive built up of air in the pleural cavity, right? So that is answer of first. And what type of injury leads to it? Progressive dyspnea. Progressive dyspnea, so it can occur because of several reasons. Maybe let's say asthma, right? Untreated asthma, complicated asthma, tuberculosis, right? As the condition would deteriorate, it will keep on increasing. So it has to be air in the pleural cavity, that is vital. Right? So this is one. And what type of injury leads to it? Injury, whether it could be an internal injury or it could be an external injury, gunshot, stab, that is from external. From internal, right, when there is some rupture, right? But that injury which leads to unidirectional flow, because that is what is acting in like a valve. Unidirectional flow of air, because then and then tension pneumothorax will occur, right? If someone has shot, bullet has entered, but if the bullet has entered and it has made a tunnel, so now air can go in and air can come out, it won't lead to tension pneumothorax, right? I would develop pneumothorax, but it won't be tension pneumothorax, right? It has to be unidirectional. That is, the bullet has entered, but now the flap of tissue has stuck it in such a way that air enters, right? But when it tries to go out, right, that tissue is obstructing it. So that is when the pressure will keep on building. So these are the two important keywords. Right? One was the progressive, and second one was unidirectional flow of air. That it could be because of gunshot, stab, internal infection, internal rupture, bulla, any of the things, but this thing should occur. On to the second one. What is the differential diagnosis? Written gunshots. No, gunshot, my dear, gunshot or stab, right? They are like an example, right? If someone stabs, right, so then that entire blade, it goes, and then that knife is taken out. But what if it has put the complete injury, right, in the form of a tunnel, right? Tunnel, so it won't develop tension pneumothorax. You know? What is the differential diagnosis? See, if you have understood, right, we are not that means there is no need to. I understand. There is no need to say curse yourself. Understanding is more important, right? As you'll be appearing for more exams, you'll be better and better. But अगर जो दिमाग में ये ख्याल था कि yes, that air is entering only, it is not leaving, then consider yourself right. What is the differential diagnosis of chest pain? For differential diagnosis of chest pain, if you have done it like this, so then it is like a big shabashi from my side. If you have done it like that, there can be a cardiac reason, right? Chest pain because of heart. It can be because of lungs, or it can be because of GIT. When it comes to heart, cardiac, so then all the three you can name three conditions so easy, right? One commonest is angina pectoris, right, which is just the cry of the heart, or second is myocardial infarction or the heart attack. So two conditions though. Is infarction, right? Over here you should be correct in the spelling, INFARCTI, infarction, or it could be pericarditis. Right? When the fluid has accumulated around the heart, so pericarditis. There are several reasons in which, say, for example, mitral regurgitation. But yeah, when we say the valves, right, the usually pain, so we'll be learning it in cardiology, the pain is only in the high pressure areas. So when you say that any of the valvular problem, so it has to be either the mitral valve or the aortic valve, because both of these valves, they are under high pressure, right? Not the tricuspid or the pulmonary, because they are under low pressure. So low pressure valve, even if it is wrong, right, it won't be generating so much of power to generate pain. Right? These are when there is mitral stenosis, or when there is aortic stenosis, or then there is aortic regurgitation. Right? Aortic regurgitation, blood comes back and unnecessarily expands the heart, it causes problem. So they are there. Right? In case of lungs, the standard pneumothorax, right? No one should have missed this pneumothorax, correct? Then pleural effusion, space is less, fluid is getting collected, big pleural effusion, very painful, right? Pleural effusion. Then the pleurisy and other consolidations, etc. But this much is basic. Then GIT, common is what we have felt many times, reflux esophagitis, right? So this is reflux esophagitis. Answer the first part of the question. First part means which one? This you are talking about? Tension pneumothorax. That's what we wrote. First part is this progressive build-up of air in the cavity. Progressive build-up. Differential diagnosis. This is the differential diagnosis. Any of these three conditions you write, right? As such, this is how it has to be divided: cardiac, lungs, and GIT. So any of these three conditions you have written, yes, there is one reason, anxiety, right? Or it could be the panic attack, right? Psychological panic attack, all these things. If you have written any of them, right, any three of them, you are good. The next, this was quite easy. Pulmonary embolism, you are 100% right. Rib injury, you are right. Consolidation, you are right. Sure, why not? Right? So all these, say rib fracture, right? Rib fracture, and what did you say? Pulmonary embolism. Yeah, sure. Pulmonary embolism, definitely this is consolidation, right? Advanced stage consolidation. Yes, that's right. What is the path of pulmonary circulation? Panic attack. Panic attack. We wrote na panic attack. Pneumothorax. All are right. Absolutely. Pneumothorax, so there is so much of it. Okay. So then this is the right atrium, left ventricle, and the right ventricle. Journey starts from here, correct? Right ventricle. From right ventricle comes out. This is the pulmonary trunk. From pulmonary trunk, it goes to the lungs. In lungs, there would be arterioles. Correct. Arterioles. From here, things would really come out and they will be going into the form of pulmonary veins. Obviously, left and right in both the cases, pulmonary veins. And the left atrium journey ends at left atrium. This much root, that is what is called as the pulmonary circulation. Acidity, it is technical word, it is like gastritis or esophagitis, right? Mostly it is reflux esophagitis. हिंदी में अपने कहते हैं यार कुछ खा लिया तो खट्टी डकार आई, मतलब कान आंख से जैसे मतलब कान बंद हो जाए. That sensation itself is so bad. So that is esophagitis. Because in stomach when there is acid, the stomach के अंदर तो there is wonderful lining which is protecting the stomach. But when that acid it comes up, esophagus has got no protection. So that esophagus, that is what is called as the typical heartburn, right? Gastritis है ना तो chest pain नहीं होगा, पेट में दर्द होता है, पेट पकड़ते हैं. But when there is esophagitis, so then it is typically called as heartburn, right? आग लगी है यहाँ पे. It is exactly in the center because it is through the esophagus that acid is passing. So that is what is called as the reflux esophagitis. अभी के लिए acidity लिखा, granted, बिल्कुल चलेगा. हाँ, so this is the pulmonary circulation. So idea is that right ventricle, that is where the journey would start and it would end at the left atrium. And you know that this entire part is a low pressure system. As we said that we don't have to write more, right? यहाँ पे सिर्फ इतना ही लिखना था कि which muscles are used for quiet inspiration. So for quiet inspiration, we have got external intercostal muscles, right? And the most important is the diaphragm. It is only for जब force की बात आती है, right? So there is enforced inspiration and forced expiration, in which we said that for inspiration you need to lift the chest, right? You need to lift the chest. So that's why the sternocleidomastoid, and I'm writing it in short, sternocleidomastoid, and then the scalene group, right? Scalenus anterior, scalenus medius, and scalenus posterior. That scalene group of muscles, they are used. And for the expiration, when it is to be forcibly, the air is to be expelled. So it is the internal intercostal muscle and the abdomen, right? Abdomen plays role, and the biggest muscle, that is the rectus abdominis. Right? So these are but the answer is external intercostal muscles and the diaphragm, these two. So that one would be your answer. Next one. Which type of rib movement is easy? I don't think anyone must have mistaken that from side. So that is that's right, pocket handle. In this, has anyone made the mistake? Right? Because it was between T4, that's right, T4 and T5. Right? This was 4. This was 5. Good. List any 5 anatomical changes, right, occurring at the level of angle of P. So many, right? Kitna easy. Sorry. That second costal cartilage, the most important one. This was the most important because see, that's the manubriosternal joint. This is the thing, and exactly over here, it is this rib number 2, right? It lands. So that was an important part. Then second, aorta pe, so ascending aorta. लिखने से अच्छा simply draw this, right? So this is the ascending aorta. This is ascending aorta. This is arch. This one is descending. All are at angle of Louis. So ascending aorta ends, arch of aorta starts and ends, descending aorta starts. Right? Third important thing was the trachea. Trachea divides into primary bronchi, right and left primary bronchi. So that is important. Fourth, very important, pulmonary trunk. Right? It is this pulmonary trunk. So pulmonary trunk divides into right and left pulmonary artery. That is. And fifth, if someone has remembered the cardiac plexus. Cardiac plexus, it lies over here. Thoracic duct as it crosses, right, etc. So this arch of aorta, see, arch of aorta, this is called as the ascending aorta. Ascending aorta, right, as it emerges from the left ventricle. So ascending aorta ends, it is the same aorta, right, which is going. Akshat, it is the same aorta. When it is going up, it is called as ascending, then it takes turn, it is called as arch, and then it is going down, right? Then it is going down. So that is the descending aorta. Angle of Lewis is another name of Manifest tunnel. Right? So descending aorta. So any of these things you have written, it's all good. Angle of Lewis is at the second rib level. Which number of ribs are called vertebrochondral? Vertebrochondral, right? Vertebrochondral, that is nothing but false ribs. False ribs, exactly. So false ribs number, that is from 8 to 10. That's right, rib number 8 to 10. All. Floating ribs name, floating ribs are 11 and 12. Yeah, these are vertebrochondral. Vertebra means on the back side they are connected with vertebral body. Chondra means cartilage. You wrote floating? Such a good student and you made this mistake. A name of the true ribs? True ribs, they will be called as the vertebrosternal. कोई बात नहीं होता है, right? चलो, see, the true ribs, they will be starting from vertebra, so they are called as the vertebro. They will be ending on the sternum, so vertebrosternal, correct? Then, so they are from 1 to 7. False ribs, they start from vertebra, but where do they end? They end at cartilage of 7th. Right? So this is 7th, right, which is ending up at what, this sternum, then 8th, then 9th, then 10th, right? This is what is called making the costal margin. So that is vertebrochondral. They are false. And that is 8 to 10. And the last one, they are the floating. So they are just vertebral ribs. Right? There is no end, their anterior end is free. So that is 11 to 12 or 11 and 12. Which area of intercostal space is not safe? Because almost I think sabne theek hi kiya hoga. So let's say this is rib number 6, right? Rib number 6, and this is rib number 7. Obviously, we can introduce the needle only via intercostal space and not via the ribs. So this area is not safe because this lower portion of this, right, it is not safe. So that is when the vein, artery, nerve are present. So that's why. Which area of intercostal space is not safe to introduce? That is the upper area. Upper area of intercostal space. Right? Remember, rib है तो lower, upper half part of intercostal space. Yeah. If you have written that, perfect. नीचे वाली area because artery vein now flows. हाँ, but दोस्त, जो पूछा गया था, question is which area is not safe, right? ये याद रखना. which area is not safe, right? Area of intercostal space. So that means if anyone has written upper area, so then it is right. If you have written lower area, it is wrong. Lower area nahi, right? Lower area is the safest one. Are you getting my point? This area is safe. जब intercostal space की बात है तो it is the lower space is safe. हाँ बस lower area of rib तो जरा भी नहीं दोस्त. Lower area of rib कैसे? Lower area of rib is this part. It is the totally. Which area of okay. So you wrote this now. Which area of intercostal space is not safe? So you wrote upper area or just below the rib. चलो ठीक है. That is fine. That is granted. Yes. If you written exactly beneath the rib, तो भी correct है, right? That is right. But from now onwards ध्यान ये रखना कि if it is written like अब यहाँ पे question ये होता which area of rib is not safe, right? So then वो question बदल जाता है. But for time being अभी के लिए as we say that your understanding is important. Whatever you have written, right? You have written below the rib, you have written the upper area of intercostal space, beneath the rib, lower area of rib, all granted, right? All granted. Very good. Next one. What is transpulmonary pressure? Transpulmonary pressure. Easy, huh? So this is the alveoli, right? This is one. This is two. This is what is inside the alveoli. So that is intra-alveolar. Correct? This was intra-alveolar pressure. And this surrounding, right? This one. This is plural. Correct. Intra-plural. So intra-plural. Intra-plural pressure is always negative. Correct? So this is the 1 minus 2. And that is the transpulmonary pressure. Perfect. Intraalveolar minus intra. True. Increased compliance leads to increased elastance in pathology. True or false? क्या लिखा? False. Yes. Correct. It is false. Simple. One reason. Compliance. Right? Compliance is inversely proportionate to elastance. Inversely proportionate. Good. Everyone is right. Because compliance is the ability to stretch and elastance is ability to return. So, all good. Very nice. I don't think इसके अंदर किसी तकलीफ पड़ी. So that black dark area, that is the tracheal shadow. And this is, you are right, that is the gastric bubble. Or the gastric air fluid level. This is air fluid level. Anything is fine. Gas bubble is right. No problem. हाँ ट्रेकिया लिखा तो यहाँ पे बोलो. What is 13A? What have you written? Anterior rib. Okay. Anterior end of it. That is more specific. That's right. बाकी सबने क्या लिखा? Rib number. कौन सा rib number लिखा? खुशी? Which rib number you have written? Shabash. Very nice. Second thoracic rib. That's right. Costophrenic angle to D hua. I'm talking about D. Okay. So this is like all of you have correctly identified. 12 में gastric bubble or tracheal shadow. anterior end
काय
of
पण मोबाईल
rib,
ठेवा सगळं ठेवा लॉकरमध्ये काय ठेवा
that's
हातात
good. And if you have written it like second, anterior end of second rib, so that is, I am happy. If you have written that, that is very good.
स्वच्छता
Or 13B, yes, that is CP angle or the costophrenic angle. Costophrenic angle. You can be specific about the right costophrenic. Is right side also important? हाँ मतलब एग्जाम में when it comes to exam or suppose if this question is asked in viva, so you have to say it is the right costophrenic. You have to be specific. What is the purpose of Clement test? I mean spelling of what? अच्छा angle. Yeah, I'll just write it down. It is costophrenic angle. Right. That's right. To check the lung maturity. Right? So lung maturity. And if it is asked more into that, to check lung maturity
शिवजींचं बघत नाही ना ते वर जायला पाहिजे वर जा
or
चढून
to check
त्याच्यावर दोन मिनिटं लोकांना
lung
मेन
maturity.
तिथं मेन स्थान आहे
So basically what we are checking the surfactant. Very good, very good. That's right. We are checking the synthesis, whether there is synthesis of surfactant has occurred or not. Surfactant. Something which starts quite early in the intrauterine life. About 20 weeks, its synthesis starts. But it starts at this level. It appears in the lungs at about 20 to 32 weeks. So after that, if the baby is delivered even prematurely, there won't be any problem. Baby would survive. Baby's lungs are ready, right? Because of the surfactant. हाँ, so lung maturity of fetus लिखा है 100% right? This is so extra. What is the function of type 2 monocyte? इतना easy, ना? This is the synthesis of surfactant. This is surfactant. You know that. Ah, this you should be able to remember that initially at birth, right? What happens to these at birth? They are 100%. Right? They are 100%. So what is the purpose of this type 1? Type 1 does what? Type 1 is for gas exchange. Right? Gas exchange. So when the baby is inside, gas exchange, there is no question of gas exchange because everything is coming via the mother. But as the baby is born, right, so these type 1, they will start proliferating and their numbers increase and these numbers, they drop. So much so that by adult, by the adult, they are just 5%. Yeah, type 3, they are for chemoreceptors. Yes, Kushal, you are right. Here it is. Smaller alveoli are less prone to collapse as compared to the larger alveoli considered. True or false? True or false? Okay, false, true, false, true, false. Few true. See, the answer is false. Because see the wall tension. इतना याद रखना. See wall tension. अरे और कुछ याद नहीं थे. You remember? I said that when you want to blow the balloon, right? Initially you have to put more resistance, and then as वो balloon फूलना शुरू किया, तो then it becomes easy. Because wall tension is this pressure into radius, right? This is the radius. Small alveoli, small radius. Big alveoli, big radius. Correct. So this is the pressure needed to keep alveoli inflated. So just imagine, wall tension remains the same. So if this number,
तीन आहे
right,
तिकडे
एक में
आणि एक
r
इकडे
is 2 और एक में r कर देते हैं 4,
भीमाशंकरला जायचंय
right? And let's keep the wall tension. Wall tension,
भीमाशंकरला जायचंय
say
मला
20, right? Let's say wall tension is 20. So now see, in this case, right, when the r is 2, तो अपना how much pressure you have to keep? You have to keep the pressure 10, है ना? So this much would be the pressure needed. And when the is 4, so then it has to be 5. So less pressure is needed. So here this is the big alveoli, this one is the small alveoli. Right? Small alveoli, if you want to keep it inflated, this much pressure is needed. It's the pressure come up, right? Immediately it will collapse. So that's why smaller alveoli, they are less prone, they are more prone, right, to collapse. वो जल्दी collapse. What terminology is used to describe black areas in ultrasonography? What's the answer? See, we talked about X-ray, we talked about X-ray, CT scan, USG, and MRI. I know this was when things are black and when things are white. Okay. I'll type it. So in our notes it was white first. No problem. White and black. अभी याद करें. X-rays. If the X-ray can pass through can X-ray pass through bones? They can't pass through bones. So that's why bones are appearing white. Right? So they are called as the radio opaque for X-rays. They are called as the radio opaque. Black, they are called as the radio lucent. Lucent means dark. For CT scan, it is considered as a density. Right? It is considered as density. That's right. So over here, when it is white, so it is called as the hyperdense. Hyperdense. When it is black, it is called as the hypodense. In both these cases, radiation is used. Right? Radiation used. In case of MRI, magnetic resonance imaging, ultrasound, this is the sound waves which are used. Over here, sound wave works on the principle of echo. Echo means bat होता है ना, right? The bat will send the sound when it strike and it will come back. So if it is hearing it, so it is called as hyper echo. If it is not hearing it, it is called as hypo echo. So it means here is the sensor. Sensor receives the sound, so then it illuminates as white, right? By the Fourier analysis, the image will appear white. If nothing is heard, so then it is said no signal received, darker. So that's why it is called as the echoic, right? So over here, it would be hyper echoic. And here, as you must have guessed, is hypoechoic. So this was our answer, hypoechoic, right? Because we asked for black areas in ultrasonography. Hypoechoic is black, that's it. And when it comes to MRI, it works on the principle of intensity. Intensity means when the strong magnetism is imposed and then you switch it off, right? And that thing occurs at a very high rate. When you switch it off and then there are the coils, right? Those coils, they are receiving the signal. So if they receive the signal, so signal is always measured in the form of intensity. So when you receive strong signal, so then it is converted to white image. So it is called as hyper intense, not intensity, hyper intense, right? Hyper intense. And same way, hypo intense. So all of them, they are, these words, they are there because of their mechanisms. This was easy. Functional residual capacity. Functional residual capacity is FRC is the combination of expiratory reserve volume, right? Expiratory reserve volume, that's right, plus the residual volume. Excellent. I think everyone is right. All of you are right. All of you are right. Yeah, that's right. Identify the condition. क्या लिखा है इसमें? That's why it was asked. Kritika, Khushi, then someone else also, Arya, Anu, Manalika. क्या blender मारा? See, it was, I said, whenever you see the dextrocardia, always watch for the gastric bubble. Gastric bubble is also on the opposite side. You know? When the gastric bubble is also on the opposite side, so this means this is situs inversus. Right? This is situs inversus. Situs inversus में dextrocardia आ गई. Right? Dextro. Fracture in clavicle acromion area where? This one? This you are talking about? So this is situs inversus. There are as such the 2-3 more pathologies, but this is because the angle was incorrect. Right? Anyway, what is the chemical name of surfactant? Chemical name of surfactant. It is di. Then anyone who has written? Dipalmityl phosphatidyl choline. Dipalmityl phosphatidyl. Good. All right. Identify the condition. Should not be a problem. Right? You are watching the horizontal fission. Yes, exactly. This is right upper lobe consolidation. Upper lobe, right upper. Middle lobe nahi, Rishikesh. Middle lobe nahi means middle lobe hota to this wall, right? This wall would have been, see, you won't see the cardiac wall. Tracheal shift also. What is HPV? HPV is hypoxic pulmonary vasoconstriction. Now we just spent 2 minutes on this, right? Because yes, say this is the alveoli, and this is the alveoli, and that's the blood vessel. That's the blood vessel which is over here. So hypoxic pulmonary vasoconstriction is if there is less oxygen, so then this pulmonary arteriole will go for vasoconstriction. Vasoconstriction. Right? Pulmonary arteriole. Say this is the cell. This is the cell. Which cell we are talking about? This is that cell which is a muscle cell. Right? This is a muscle cell. It is a smooth muscle cell. Smooth muscle cell. So kahan se uthaya? If you take a cross section of this particular artery, so it would be like this, right? This arteriole. In this arteriole, right, there is a layer of smooth muscle. So these smooth muscles, out of that one cell is what we are taking. Right? Same thing will happen on all the cells. So these smooth muscle cells, you are 100% right that when these smooth muscle cells, they contract. When they contract, they will decrease the caliber. They will lead to vasoconstriction. So these smooth muscle cells, they contract contract, and they lead to vasoconstriction. Correct? So why this thing is happening? Now we are discussing it. So we talked about that there is a potassium channel. This is a potassium channel. This potassium channel is special because it is oxygen sensitive potassium channel. Oxygen sensitive potassium channel. So this oxygen sensitive potassium channel, when the oxygen is present, right, so this channel will remain open and the potassium will keep on going out. It will keep on going out. Clear? Right. There is another channel also, which is the calcium channel. This calcium channel is voltage gated. Voltage gated. That means at specific voltage, right, it will trigger. Now, what happens is, as the oxygen, when the oxygen is present, right, and in every cell we know that there is always a sodium potassium pump which is constantly day night going on, right? It never stops. So what this potassium will do, the sodium potassium channel, it will throw 3 sodiums out and it will pump 2 potassiums in, and this thing is working day night non-stop. Correct? It is occurring day night non-stop. Now see the scenario. When the oxygen is there, I'm drawing the graph over here. When the oxygen is present, think as if we are sitting inside. We are all sitting inside the cell. In the inside of the cell, oxygen outside is present, so that's why this potassium channel is open, so potassium is going out. But at the same time, sodium potassium pump is also working, so it is taking the potassium in. So potassium is coming in and potassium is going out. So constantly, right, that thing is happening, right, continuously. It is not constantly happening. So over here, this cell won't fire because it is the stable system, right? It is the stable system. Potential is slightly going up, going down, right? But it is just to keep on moving like this. So this calcium channel, they won't be triggered. Voltage will not be developed, right? Because the amount of these positive ions, whatever are leaving, the same amount is coming. So it is stable. Now one day it happens like that this oxygen is not present. Right? For some reason there is hypoxia, oxygen not present. Oxygen not present, but then this channel will get closed. When this channel is closed, now starts sodium potassium pump is not constantly working. So sodium potassium pump, right, it is working. So it will keep on dumping this potassium. Right? Potassium is now it will start rising. And as it rises, at one point of time, there is a voltage is developed and the calcium channel is triggered. Calcium channel is triggered. And as the calcium channel is triggered, so there will be large influx of calcium inside the cell. When they come, that means this cell would contract. When this cell would contract, it will lead to vasoconstriction. So in other words, hypoxic pulmonary vasoconstriction, whenever there is decrease in the oxygen, that leads to vasoconstriction in the pulmonary vessels. This is completely reverse as compared to the systemic, in which if there is hypoxia, the vessels will dilate. So this is the HPV. What was the answer of this? What would be the mean arterial pressure of a person with blood pressure? Anyone who has written the answer of it? Very good. Very good. This is good. Correct. You are 100% correct. Right? Because it is the systolic versus diastolic, and it is the timing is 1:2. So you have to just make it like 150 and 90 into 2, that comes to 180, which makes a total of 330. We need to divide it by 3. So if you have given the answer 110, this is 100%. Every one of you.
होय
Very
होय होय
nice.
दोनच राहिलेत.
What is
ते
core
सगळं
pulmonary?
कसं
Core
सगळं पुढे
pulmonary
येतंय
was
निवांत
that
तुम्हाला सुद्धा
is
आणि
easy to draw. It's very
नाही
good habit.
बघूयाच.
Right?
कारण मला
So
काय
in
म्हणायचं
core
आहे
pulmonary,
जरा एरिया
this is
चांगला
the
वाटतो
lung.
तुम्हाला
Over
व्यवस्थित
here there
सांगा.
is pulmonary. That's right.
हां
That's right.
तेवढं जरा
Pulmonary
तुम्ही
hypertension.
काय
Right.
काय
So
नाही
whenever
आता
there
सवय
is
झाली की नाही काय
pulmonary
वाटत नाही.
hypertension,
खरं
so that will
सगळं
put
जागा
the
बघा आणि
load,
सगळं संरक्षण
that will
आहे.
put the load on
पाणी 24
right
तास आहे.
ventricle.
मोठे फॅट तुम्हाला मिळणार. काय आता दोनच राहिलेत बघा सगळे
Increase
गेले.
pressure into the right
बर
ventricle. So that will lead to right
शेवटचा
ventricle
पण गेला
enlargement or right
चौथा मधला
ventricular
पण गेला
hypertrophy. And then at one point,
आता सहावा आहे.
this right ventricular
बर
failure.
सहावा आहे
It
काय आणि बघायला पाहिजे आणि
fails.
कुठला आहे.
And this
वन
thing
बी एच के
is
कसं
called as the core pulmonary.
म्हणून जरा जरा विचार करा.
So whenever there is, I'm again, so there is
हो हो चालते
pulmonary
चालते.
hypertension. So because of pulmonary
हा उद्या
hypertension,
येणार
there will be increased pressure into the pulmonary
हां
trunk
घरात
or the
तुम्ही घरात जरा चर्चा
pulmonary
करा हां सगळ्याचं एवढं
pulmonary
आपल्याला
veins,
फिरलो
pulmonary
नाही
arteries, okay, the pulmonary
म्हणून
arteries.
म्हटलं एकदा
So
घेतले की
increased
झालं.
pressure, that increased pressure will be into the right ventricle. So right ventricle hypertrophy would occur,
ठीक आहे.
right? And right ventricular hypertrophy, and when that right ventricular hypertrophy leads to failure, so that is what is called as the core pulmonary enlarged ventricle. That's right. Which are the two important pressures responsible for the balance of fluid? But again, it should not be a problem. One was the hydrostatic pressure, correct? Hydrostatic pressure, and second one was because of that was the oncotic pressure, which was the oncotic pressure. That's right. Same. You can write it like colloidal osmotic pressure. It is also one and the same thing because both of them, it is like they are dependent upon the protein. That's right. Name two reasons for the development of pulmonary edema. Right? It was quite related to that. So in which this occurs when there is increase. So basically over here, either the increase in the hydrostatic pressure or there is decrease in the oncotic pressure. So there is high pressure, right? So that is high pulmonary hypertension. Pulmonary hypertension, it can occur, or when there is loss in this protein. So protein energy malnutrition, or when there is less protein. That's right. So like say liver disease, because protein is made by liver. So liver disease, it won't be making it. Or the protein is lost from the body. Say for example, nephrotic syndrome, in which there is basement membrane is disrupted. So big protein molecules, they are also filtered out. So they are going. Or there is enteropathy. Person is eating the protein but is unable to absorb it. So enteropathy, right, in case of GIT. Or if there is lymphoma, right, lymphatic system itself is augmented, right, infection to lymphatic system. That's right. So any of these two you have written is fair.
नमस्कार.
Which are the two types of polypeptide chains?
झाले की फोन करा.
Alpha 2,
चालते
delta 2. That's right. Alpha 2, delta 2. That's right. And that is HbA2. Alpha 2, gamma 2 is HbF, fetal. Right? That is fetal. And standard apna alpha 2, beta 2. This is type 1. Ductus arteriosus. It was easy because pulmonary trunk and that's right. So this is the aorta and that's the pulmonary trunk, and here it is. That is the ductus arteriosus. So yes, it is pulmonary trunk and the aorta. All of you. Right? Name the lobes of left lung. इसका आंसर क्या लिखा? upper lobe, lower lobe, Shabash Dinesh, good one. Akshat, good. Arya, good. Shita, good one. Thank you, that. Right. People miss this. Good one. Superior and inferior. Yeah, this thing can also be written like superior and inferior. It's fine. Superior or inferior. But my expectation was for this link. वो लिखा कि नहीं? Finally, this one. This one is Shabash. They are the curly B lines, right? They are very right. They are called as the curly B lines. Curly B lines, they are the classical thing for interstitial pulmonary edema. Right? If you say pulmonary edema, it's fine, but to be specific, it is the interstitial pulmonary. But identifying curly B lines itself is a great thing. So, good one. So tell me, what was your score? What was your score? Okay. 20, 26, 27, Deepanita 27. Okay. Manalika 22, Dinesh 25, Arya 25, Vishal 26. Okay. Siddhi 23, Heer 26. Good. Sanya 20, Puja 26. Good, good. Junaid 26. Anand 20. Shweta 22. No problem, no problem. See, the attempt itself was a great thing. I went 27. यार अपना नाम तो लिखो है. Kritika 20, Kritika 23. See that this way, at least you must have experienced one thing. During this entire test, it was completely stress-free. You know? Dhire will be making it more and more complicated. Right? But again, you won't be having any stress. The concepts, if the concepts are good, I could have made such a test कि किसी 50 में से 15 मार्क लाने में मुश्किल हो जाए. But then what's the fun? These concepts, if you have scored less than, right, I'll not be taking that. But anyone who has scored less than 15 now, देखो this, don't get disheartened. Right? One is either you are very honest, मतलब एक word भी नहीं लिखा तो straight away you have deducted 1 full mark out of it. ऐसा भी हो सकता है. Right? So that's totally fine. समझ आई ना? Because that's more important. So from next week we'll be starting with cardiology. Now for the cardiology, see, we are right now 54, right? अभी कितने लोग हैं? 54. इसमें मैं भी एक आ गया. So 50. So this is what really happens. I'll upload. Just let me finish this part. What happens is when this number starts getting less now, तो फिर ये लेक्चर ना जैसे लास्ट टाइम हुआ था फिर वो डिसकंटिन्यू हो जाता है. And in cardiology, so it would really happen that you need to develop the capacity to hear for 2 hours. Because see, इतने superb concepts होंगे. There will be so many concepts regarding. We'll be studying the X-rays. Right? When we'll be learning about the congenital heart disease, all the heart disease. We'll be learning the entire embryology, how the heart really develops. Once you have understood it, all the congenital heart diseases, like you will see and you will find, yes, it is this. ECG is something which we'll be learning in tremendous detail. So please develop at least this thing. Because what happens is कि वो सामने number दिखता है, right? there were 89%, and then by the time test khatam hui 74, right, and then the number dropped to 52. So if that thing occurs, same thing. Yeah, it's sad. It's sad. I'm telling you, it kills the whole motivation. And last time when the number started dropping below 25, we had to discontinue the lecture. And yes, I really felt very bad for these 25. I really wrote them email personally. Those, yes, but when the number is so less, and so it is like several mails they are coming that are thak jate hain. Those maybe I have to. It is like this is not the only lecture. Right? I teach even other students. I teach even cyber security. Any of the training to our defense or the police, they are all complementary. Right? I'm not charging even one single rupee. It is like they said that हमें कुछ देना पड़ता है सरकार को दिखाने के लिए. So that's why it is 1 rupee per lecture. Right? 1 rupee per lecture. That is what it is. But again, they are of 1.5, 2 hours. I really felt bad for these 25 students last year. ऐसा इस बार ना हो ध्यान. Because when the number started dropping below that, then management also decided that chalo, now it is not feasible. So then they were deciding. Okay. So from next week we'll be starting with cardiology. I was one of those from previous batch. हाँ सी तो आप थे तो you must have known ना कि क्या हालत थी. लास्ट में तो कितने कम आते थे. Then finally I had to say कि यार अब से बंद. हाँ 10 exactly. This was the thing. 10 तक अपने चलाया. 10 तक चलाया. But इस बार ऐसा नहीं कर. I really want wish. मतलब आप मैं एक सेंटेंस में बोलूं मेरा फायदा उठाओ. हाँ, see this, I know we were there in Diwali को भी क्लास. हाँ, on the day of Diwali we studied. इस बार भी बिंदास, मतलब कोई प्रॉब्लम नहीं. जस्ट मतलब बड़ी रेयर कोई चीज होगी तो ही क्लास बंद होगा, बाकी तो नहीं. डेफिनेटली नीट. All right. So wish you a very happy weekend. Right? And so from next week we'll be starting with cardiology. क्या we need stethoscope for cardiology. Stethoscope हो ना कुछ तो अच्छा रहेगा. At times I'll tell you that okay, put it on your heart, listen to the first heart sound. Right? Listen to the first heart sound. Then I'll say okay, go to the pulmonary area. Now it is very easy कि ठीक है चलो, this is the chest, right? यहाँ पे draw किया and this is the pulmonary and this is the mitral. वो theory. When you will put the stethoscope and then you will experience कि हाँ this is my mitral valve, ये मेरा mitral valve बोल रहा है, right? You will never forget in your life. So there are stethoscope available. Right? अभी से लेटमैन के लिए मत जाना. Right? Lettmans, they are very costly. So you can go for the doctor. Right? This is one brand which is reasonably priced. 1000 रुपए के अंदर. Right? All these are under 1000 rupees. 1000, 1200 bus. Once you are master of it, so then you go for the best of the best. I'll say you go for cardioscope. Right? They are the Littmans, which is the digital one. I'll show you next time. It is into another room and I'll show you. Okay? So thanks a lot. Thank you so much. It's a pleasure for me to talk to all of you. अच्छा, they have given the stethoscope. चलिए एक काम करना, स्टेथोस्कोप का जस्ट एक फोटो मुझे भेजना. ठीक है, just send a photograph of that. I'll find out. ठीक है, must be good. So thanks a lot and मिलते हैं. See you soon.
हॅलो. हॅलो. हां. बर. आमचं आधार कार्ड गावाकडलं आहे. होय. हां. होय. हं. हां हां. अच्छा. मग पत्ता बदलून थोडा घ्यायचा.